Hi, my name is Jonathan Cleefield. I'm a radiologist at the Beth Israel Deaconess Medical Center in Boston. Your doctor has requested that you undergo a procedure known as a CT scan of your head. What is CT? A little history will put this remarkable medical advance in perspective. Before CT, X-rays were used to image the head. Unfortunately, this technique was only able to show the bones of the skull and could not distinguish any details of the brain. Given this major limitation, in 1972, the medical world was stunned when an engineer from EMI, the same British company that produced the Beatles records, and a neurologist presented their new technique called computed tomography, or CT. This incredible advance over regular X-ray imaging was that different parts of the brain, including the fluid-filled spaces called ventricles, could now be imaged distinctly, as well as the gray and the white matter of the brain. The tomography part of the technique meant that the brain was displayed in thin individual slices, making it easier to decipher the complex anatomy, rather than having all structures lay over one another, as is the case with a standard X-ray image. Finally, abnormal findings, such as a blood clot, could now be clearly identified. Over the years, CT has undergone tremendous progress in terms of speed of performance of the study, as well as vast improvement in the sharpness or resolution of the pictures. For example, a head scan in 1973 took up to 1 hour to perform, and the pictures had a very coarse appearance. Because the technique was so slow, many of the pictures were often degraded by patient movement. Now, the same test can be obtained in less than 1 minute, and with the pictures being up to 10 times sharper. This increase in image quality is much greater, for example, than the switch from standard TV to HD TV. CT is very helpful in being able to look for bleeding either around or into the brain due to diseases such as a stroke, ruptured aneurysm, or from head trauma, or to image dilated ventricles called hydrocephalus, which can produce headaches or be a cause for impaired memory and thinking, which can be symptoms of dementia. It can also help to diagnose a tumor or a vascular malformation. While MRI scanning is certainly useful in these conditions, CT is now the first line of imaging in the emergency department for evaluation of the patient because it is very fast, has essentially no contraindications that an MRI may have, such as a patient with a cardiac pacemaker or has a metal fragment in the eye. Also, certain areas of bleeding, such as the spaces over the brain, are often better detected with CT than with MRI. In the case of a stroke, every minute counts, as the brain is a very fragile organ. To diagnose a stroke as quickly as possible helps to minimize brain damage from this very common disease. When you enter the radiology department for your exam, you may simply be directed to enter the room where the scanner is located. It's usually not necessary to change into a hospital gown. You'll then be asked to lie on a table. Once the scan begins, the table moves slowly so that each slice of brain tissue can be examined consecutively while the X-ray tube and detector move around your head. You won't see either the X-ray tube or detector because they're enclosed in a donut-shaped device called a gantry, which houses this equipment. Your head will pass through this gantry, but the opening is very wide. Virtually no patient suffers from claustrophobia, which could be a problem for some patients undergoing MRI. As the scan is conducted, the moving X-ray tube and detectors make a soft noise, but not loud enough to require any ear protection. The exam usually takes less than a minute. The technologist operates the machine from an adjoining room with a large picture window which allows them to continuously monitor you. An intercom also allows the technologist to hear you. All that's required is that you remain still for the brief period of scanning to prevent the images from being blurred. Because the examination uses X-rays, you may have some concern about the amount of exposure this test delivers. It's good to remember that the X-ray beam is confined to the head so that other sensitive body parts, such as your reproductive organs, receive virtually no radiation. Even if you are pregnant, a head CT scan can be obtained if felt to be medically necessary. In this case, the technologist will place a flexible metal apron over your chest and abdomen, which further limits the already very small amount of radiation which might reach your baby. Some types of examination questions, such as to rule out a tumor, do require that the CT scans be obtained with the use of a contrast agent, as many tumors are more clearly seen because they take up more of this material than normal brain tissue. Please refer to my podcast, which deals with this potential part of this procedure. Once the scan is completed, the image data is processed virtually instantaneously, with the completed study sent electronically to your radiologist, who interprets it often within a few hours, or in the case of an emergency study, immediately. He or she then dictates a report, or if the study is an emergency, reports immediately to the referring physician, often simply telephoning your physician. However, even in the case of non-emergencies, the exam results are often communicated either verbally or in a report in a few hours. This team approach is critical to providing the highest quality health care, which all of us feel is our responsibility to you, our patient. Finally, if you ever have any questions about your exam, either before or after it's obtained, your radiologist is always available to speak with you directly. Thanks for listening.